think World AIDS Day is just one of those things that can refocus us on something we've learned to live with over the last 30 years. You know, when the HIV/AIDS epidemic first started, there were a lot of actions that occurred. People chaining themselves to gates of the FDA and the NIH demanding medication, who really moved the ball forward as far as getting us medications and getting help for those with HIV. It's a little less dramatic in this day and age, but nonetheless it's still important to at least pause and think about how far we've come with a disease that in the medical lingo is really relatively young and relatively new, but that we haven't found a cure, that we have not found medications that are easy to take, that don't have side effects, that we can't lose sight of the fact that the fight on HIV, while it may look different than it did 20 or 30 years ago, it's still ongoing every day, and we have to keep pushing for research and support for those who are living with this disease, and most importantly, try to find a vaccine that we can stop this from ever happening again.
Mm-hmm.
I think, one of the myths is that anyone goes unimpacted or unaffected by HIV and AIDS, because it is truthfully across the world, maybe not in Indiana, maybe not even in the United States, but on the international stage, it is the #1 killer of people in sub-Saharan Africa. It is the #1 cause of death in children in everywhere except the developed world, across the entire globe. And so to think that that doesn't affect everyone is a myth. We've lost so much potential as far as who could be the next great physician or the next great physicist or the next great politician, or when you lose potentially the next generation of people, it is a problem for everyone. So in an effort to increase awareness and remind people that intervention is successful and we can prevent transmission of HIV from mother to baby, we started the One Test, Two Lives campaign, which is really came out of the CDC initially, and we tailored it to Indiana. It's a very nice campaign because it takes everybody who's involved in the care of mothers and babies and HIV-positive women and puts them together in one group to sort of educate. So the Indiana State Department of Health, the obstetrics department here at Indiana University School of Medicine, the Midwest AIDS Training and Education Center, Health and Hospital Corporation, and the Ryan White Center have all banded together, put together a website, put together a public awareness campaign to educate not only physicians about what can be done and when can be done, and make sure they have access to all the materials to have the safest outcomes for the moms and the babies, but also for the patients as well, so that they can be empowered and know what they should expect from their prenatal care that can help them have a completely healthy, non-infected baby.